Hello, my name's George Robinson. I'm a fourth year medical student at the University of Nottingham. I'm here to present my placement on specially selected module private healthcare. So my private practice placement was based at the Nuffield Health Hospital in Derby. Here I was able to perform a number of different activities relate in clinical and non-clinical settings, get a good idea of the different processes within the hospital itself. The aims of the placement were to get an idea around private and secondary healthcare, the insurance and funding, coding and costing involved, billing and payments, and waiting times and choice of providers, and how this practically works for the public. Some background first to Nuffield Health is that in 1957 Nuffield Health acquired a nursing home down in Bournemouth and reopened this nursing home as the first hospital its acquisition. In the first 10 years back, following this in 1957, they acquired 10 other sites and slowly became the large entity that it is today, currently having 337 hospitals and 140 fitness and wellbeing centres around the UK. One of the things I found quite interesting though was Nuffield markets itself as a trading charity. It states not driven by the demands of shareholders, and instead profits are reinvested back into the company. For example, in 2015 there was an investment of £100 million back into the facilities that Nuffield is able to offer. Just as a brief idea around some of the pros and cons of private healthcare, and particularly when comparing to the NHS. I think firstly though it's important to state here that Nuffield can't function without the NHS. There are certain conditions, comorbidities and patients that the Nuffield Health private practice cannot take on, as it isn't able to care for the needs of individuals in emergency care and with severe medical issues. However, I would argue it can be looked at in the reverse. More than a third of NHS funded hip and knee cases are carried out by private hospitals in the UK. This is due to an inability to deal with the workload and the backlog of patients needing these joint replacement surgeries. And then this year was the first year where more hips were replaced in the private setting than in the NHS. Some pros though regarding private practice, of course, is the choice. Individuals can get a choice of what consultant they'd like to see at different facilities. Individuals can have their own room, en suites, they have a TV, and a lot of access to things that aren't usually available in the NHS. For example, Wi-Fi that isn't in every hospital in the UK at the moment. Cosmetic procedures can be accessed, and there's this alleviation of pressure that the NHS is under in terms of a backlog of patients on waiting lists to get a lot of these services. And then of course the big thing being that patients can be seen faster by their consultant. Cons, however, you'd see, as I mentioned earlier, complex cases can't be managed. There's no access to emergency treatment. There is, of course, a high cost, averaging around £15,000 for a hip replacement. And for individuals, of course, this limits the access to the service. And then, of course, suitability. Not everybody can access the service due to their comorbidities and other medical issues they may have. Firstly, one of the things I had was the pleasure of sitting down with Amanda Kidd to look at how patients are found in the Nuffield Health. I was able to see the hard work she goes through on a daily basis to build relations and with other key opinion leaders in and around Derby, but also was able to see how ways she can directly market to patients to be referred into the Nuffield Health practice. So One of the things, of course, is the website, looking at different ways to optimize search engines, and ensure that the relevant information is always up to date on our website. The GP relationships also, I had the pleasure of going to visit GP practices with her to raise the profile of different consultants we have, so services could be known to the public about what could be accessed. There's also direct advertisements, so there is collaborations with local football teams, so Derby County, Nottingham City, also the cricket clubs, and the community engagement too, so events in local health, local gyms and healthcare, and education for health education. It was important as well that was noted there's a real drive for in 2024 to look at underprivileged areas and individuals in different communities that probably don't have the normal access or the average access to healthcare, unlimited resources. I found that quite interesting because, of course, private healthcare itself, with it being a cost, it would set a divide between in different communities. However, the idea regarding this is to promote the services of Nuffield for those that can access this, but also through different methods, which I'll come to later, where you can choose to go through Nuffield Health and have this funded via the NHS. This is an image of some of the materials as well, so some of the offline materials that we use in different settings to highlight to the public and healthcare professionals around what services the hospital provides. In terms of the funding options that are available to get to a Nuffield Health patient, there are three main routes. The first being a self-funded patient, and it's the most costly to a patient. This would be someone would fork out the money up front, or they'd have a payment plan in order to pay for their service. The insurance would be the next sort of next step down in terms of how much outright this would actually be. And of course, the insurance company will pay for this and negotiate costs with the hospital directly or with the Nuffield Trust directly for how much each operation, procedure or consultation would be. And then finally, there's the NHS paid route, which is an obligation the Nuffield must take on in order to operate, where they take a certain amount of patient referrals each year. It's particularly though in hip and knee joint replacement surgeries in this regard. This is just an idea of funding. Self-funding, of course, as I mentioned, is the most lucrative to Nuffield Health and as a entity. Issues with each one can be seen though. There's an expectation for patients with the self-funded option. So the waiting times and different clinical opinions is something I saw firsthand. Patients get frustrated either that they would maybe need to be booked into the next month or 2 months down the line, and also differences in clinical opinion where they perhaps then like to go and find another consultant to agree with this medical issue. With insurance funded routes, there isn't total choice regarding a consultant. Patients can only see the individual consultant that their insurance company have approved. So it does eliminate really that absolute choice the patient would have. And of course, NHS paid patients. I've mentioned here about a discrepancy in costs, which could lead to consultants limiting NHS numbers. I did see vast discrepancies in how many NHS patients consultants would allow booking teams to put onto their lists. It does mean that, of course, there's differences then in how much the consultant gets paid and how much the hospital gets paid. But it was interesting to see that consultants do have a large say over how many private versus NHS patients they can see within the Nuffield Trust. I'm unsure on how that is different though in other healthcare systems, private healthcare systems, for example, via hospitals. Then of course there's just building onto this, there probably is an issue under all of this, which is an unspoken issue of consultant bias and feedback gathering. Every hospital and every doctor tends to use the service Doctify, which collects subjective feedback on their appointments and the public can review their doctor that they've seen. However, one of the things I found quite interesting was not every patient will fill out a feedback form, and not every consultant will give a feedback form to every patient that they have. And of course, this therefore vastly skews the feedback form generated on Doctify. But of course, there are more objective data available on joint registry and success rates, and you can see that and get a more idea of the how good a consultant is. But my question to you would be, are the public really going to use that? And if so, how much of a percentage? Of course, that's going to be very minimal. Referrals themselves come in through a number of different channels, particularly in the inpatient setting here. There is this choose and book service, which isn't necessarily well known to the public, but individuals can request via their GP or healthcare provider to be referred via the NHS into private practice for hip and knee joint replacements. We get referrals from the Royal Derby Hospital also. Directly, consultants can send patients over that perhaps been on waiting lists for a while. And then there is outreach as well. So Amanda Kidd particularly will go out to reach different GP practices and generate a relationship with different GPs. All of this though is quite interesting how it collates onto CCG report waiting lists. I've mentioned here that the targets back in prior to COVID-19 pandemic were 18 weeks. So from the date the clock starts ticking, which would be the date that the GP, the physio, the orthopedic surgeon, whoever actually filled the form to say yes, this patient needs a joint replacement surgery, the clock would start ticking from then, and they'd have Nuffield Health would have 18 weeks to make sure that that replacement surgery was done. Post-COVID, though, we moved to a 100-week waiting list. It slowly went down to 90, and currently we're at 78 weeks of as a target range for that. It was quite interesting in seeing this in the clinic. Then the highest waiting list I found on the system was a 93-week. However, surgery was scheduled for the day after, so tomorrow, at the time of writing this presentation. PIDMAS refers to patient initiated digital mutual aid system, a government incentive which, frankly, from a lot of subjective information from the staff, seems to have been a government created system and plan which caused just havoc within a lot of healthcare systems, where patients could book no matter where they were in the country to have their replacement done at their hospital of their choice. It's only added to waiting lists and created more of an issue regarding these weak targets, and really proved to not be very helpful. However, the future of private healthcare, the data provided only really shows the data provided shows there is only an increase on how much private operations are being performed each year. Of course, a third of hip and knee operations are carried out for the NHS in the private sector, but you can see a general curve here of private practices only building in revenue and footfall each year. There's also a suggestion of a generational shift. So a report with the Independent Healthcare Providers Network showed younger people between the age of 18 to 34 are very positive about the private sector and even likely to have used their services. Limitations I saw on my placement, though, I saw there was probably this limited scope, which of course mentioned before, but an absolute inequality and access disparities for individuals from different backgrounds. But of course, I did also see individuals such as the operations manager, operations director Deborah, and some real plans for 2024 to try and build on this for the new year. I think technology was a clear issue in terms of the Nuffield Health being very paper based. There was a reliance really on paper, and it seemed a little antiquated. And then of course there was a space issue, so only 3 theatres at the moment, although driven incredibly tightly um, by Donna and Deborah and all of the individuals within the theatre ward. I couldn't. I was incredibly impressed at how regimented and professionally ran it was. They're able to use those 3 theatres to the max. But one of the questions I probably would pose is, would this open up to competition? Would this allow for other healthcare agencies to come into the space? There is already, of course, the Derby private healthcare practice within the Royal Derby Hospital at the moment. Or the other thing would probably be the um, limitations to the building itself. The aesthetic does look fairly dilapidated. There's in some areas, although limited, wallpaper is probably 40, 50 years since it was last changed. Then, of course, I think some of the things that have already been dealt with well are the public perception and trust. You can see, as the previous slide showed, there's a real increase in the amount taking up services in private healthcare and competition with the NHS. Of course, there isn't really it's happening at the moment. The NHS, it seems to be reliant for many different services, though not all services, for Nuffield to take on these and staffing challenges. One of the things I found interesting was the staff there. There were no vacancies needed, and the staff themselves seemed to have a great attitude and a great, really collaborative process with each other. It was seemed fun, and everybody seemed to actually enjoy being at work. Then my final slide here just refers to the ethos and some of the things that I found in fascinating while I was at Nuffield Health. Firstly was this drive for patients. I feel like everybody was able to have a real push to bring in more patients and had the core values and needs of the business at true to themselves. The secondly was patient care, and finally resilience and perceptive administrative teams was something I routinely saw, and how teams work so strong and were able to come into work each day and work seemingly at 100% each day I was there for the 4 weeks. Donna King, for example, I thought she commanded respect but also compassion, and she really bridged a gap between the consultants and all of the theatre staff. I think that was really a key factor in the successes so far. Deborah Sabler epitomised having a finger on the pulse at all times and knowing everything that's happening in the hospital. And Gemma Shelton, the PA to the hospital director, showed how there wasn't really job boundaries. Anybody could go above and beyond their normal duties, and often did. And she was one of those individuals that I saw do that. The radiology team, particularly as well, I saw them do non-clinical roles, so sitting on reception, taking up any other role that would possibly help the goals of the company slash charity. And the outpatients team again, so they coordinate clinics incredibly efficiently. They step in for consultants and for receptionists to ensure the good customer service for patients. And finally, the resilient team that I saw. So inquiries and bookings absolutely being the blood supply of the company. They deal with this real issues that would happen in terms of maybe a cancelled clinic or something that may have gone wrong on the day, and they deal with it to a high level of customer service, and being the face of the company often take backlash or from the public or patients that wasn't necessarily their fault, but then immediately to go back to their role to book in more patients, which was incredibly great to see. The reception team also, Jay and Jackie and Lisa, I spent a lot of time with those 3 individuals. The camaraderie and the real compassion for putting the values first of Nuffield Health, and really you could see how they really exuded confidence in themselves and the company, and really helped to make my time there, specifically as well as all the other staff, to see enjoyable and pleasant. And then finally, here's just a picture of a lot of the individuals that helped make my experience at Nuffield so pleasant. Thank you.